The Patient's Guide to Successful Facial Plastic Surgery. Clearly, most patients consider facial plastic surgery because they have things about their face that they'd like to fix. And as a facial plastic surgeon who's practiced for many years at the top of my field, I'm very aware we have more facial solutions available to us than ever before. These include technologies for skin tightening, advanced thread lift materials, new types of facial fillers, botulinum toxin, and lasers. With all these products, one might think it would be very easy to have only satisfied patients. Yet that's not always the case. Here's a guide. How can I be sure I'll be satisfied with my facial plastic surgery? Satisfaction in plastic surgery begins with a systematic, individualized consultation. During the consultation, I need to understand what you're trying to achieve. So I need to listen to you. I need to be honest with you about what I can achieve and what my limitations are. And as a patient, you need to listen to what I can safely achieve and process your options to decide what suits you best. So a good consultation is a bi-directional process that involves both of us expressing what we want while the other listens. Having satisfaction in plastic surgery also requires good judgment on the part of both the patient and the surgeon. Often, I find a patient who wants something that they cannot have. An example might be a patient who desires lip augmentation who'd love to have their lips augmented permanently. So some of my patients ask for a permanent solution. My experience tells me that permanent solutions make the lips look unnatural, lumpy, or bumpy, even making them stiff, resulting in an unnatural movement. So my patient and I have to communicate about these realities, my experience, and better options. What should a facial plastic surgery consultation feel like? I listen to my patients. A lengthy and careful consultation with bi-directional listening is the key part of achieving real satisfaction in a surgical procedure or in even a non-invasive procedure. As I tell my fellows when I train them, do not shortcut this process. And if a patient tells me that they want a procedure that is very conservative and looks so natural that it's difficult for others to notice, I need to listen to them. Similarly, if they want an aggressive procedure to suit their own personal sense of style, I need to listen to them. The bottom line is, you tell me what you want to achieve, and I need to tell you what the options are. When I have a consultation with you, I'll tell you, I don't like these products because there are complications associated with them. I certainly don't want to have to remove an implant or cut out an injectable material. The consultation requires my patients to listen to this. The tough part arises when patients have already decided what they want, even if it's likely not the most effective or the safest solution. And I face the reality that some of my patients will go elsewhere to get the procedure that they want that may increase their potential complications or side effects, ignoring my advice. What happens if a patient is not satisfied with the results of a given surgical procedure? Unfortunately, dissatisfaction does occur. The reasons can be multiple: lack of communication, unreasonable expectations, and then maybe the procedure just didn't come out as well as any of us, the patient or I, planned. Although generally rare, when I have a patient that is dissatisfied, I try to revert back to the same systematic approach that I used during the original consultation. However, a revision procedure consultation can be more emotional because most patients didn't expect that they'd ever need a follow-up surgery. I try to look again at what the patient wants after the initial procedure, and will I be able to achieve that? And I have to be honest about that to them and to myself. I try to listen to their concerns and to tell them the predictability of achieving their wants. This is an important process that requires me listening and both of us maintaining trust. Experience and trust are fundamental in all relationships, and especially true in plastic surgery. I value the trust my patients have put in me, and I try to maintain that even when they're not happy. How should I choose my facial plastic surgeon? Obviously, the choice that you make in your surgeon is very important. It requires patients to trust the judgment and skills of the surgeon, and the surgeon should never violate this trust. It's very common for a patient to search many places on the internet and then feel that they have chosen the best in the field to do their surgery. Patients should realize that for the most part, the things that they read on websites and Instagram and in social media are contrived by the practitioner to make the practitioner look good. It's really important that the patient feels there is an honesty and integrity about the surgeon, and that it carries through to their website and to their marketing in a way that portrays themselves to their ability to achieve their excellent results. I look at any relationship as something that needs to be cultivated. Should I travel as a patient to another country for facial plastic surgery? I think traveling within the US is very typical, but traveling outside the country is very complicated. Why do I say that? You should feel the trusting relationship you have with your surgeon that will carry over into the post-operative care, and I feel the idea of going to another country is a problem in regards to post-operative care. Time zones, language barriers, terminology, it all impacts effective communication. As a simple example, I give my patients my personal cell phone number so they can contact me anytime before or after a procedure. It's just one simple step. Trusting my patients with my phone number is warranted because they've placed trust in me. You deserve the same. So overall, I would say that in order to have success when you do plastic surgery, you need a few things. One is you need to choose your surgeon carefully. I need to choose my patients carefully. Then together, we need to choose the procedure or procedures carefully. Then I need to do them very well, meticulously. And then I need to take care of you. It's 4 things: careful selection, careful choosing, meticulous execution, and then compassionate care. Those are the 4 things that I think that you need. I look forward to seeing you in my office for a consultation. Thanks a lot for watching.